violence online during lockdown. Now, this is a little bit blurry just because it's been blown up, but the original report is on our website and you'll be able to see it. But in terms of the types of prejudice that young people witnessed online, the most common forms were homophobia, so 56% of LGBT plus young people witnessed online homophobia, racism, 55%, and transphobia, 48%. 45% of LGBT young people also witnessed hurtful comments or posts related to their body image or physical appearance, and they were more likely than other demographics to have experienced that. Girls and young women were almost on par with this. LGBT young people reported seeing homophobia online at more than double the rate of other demographics, while when it came to biphobia and transphobia online, they reported this at more than triple the rate. And LGBT young people also reported seeing sexism and misogyny online at more than double the rate. So I haven't included it here, but in the actual report, you'll be able to see these different charts and graphs. So this is the types of prejudice that were most commonly reported by LGBT young people, the types of online hate that was being spread against different protected characteristic or minority community groups. And if you compare this to some of the other samples that we isolated out, you will see, just how big the spike was for LGBT young people. Now, in terms of online prejudice, there is the phenomenon that if you can't identify it, you can't report it. So for a respondent to have told us that they had seen or witnessed a certain type of prejudice online, then they need to be able to identify it too. So one of the things that we are aware of is that it might be the case that by virtue of experiencing prejudice or bullying themselves as individuals, LGBT young people might be more likely to recognise that happening elsewhere. So they might be more likely to identify online homophobia when they see it, or they might be more likely to, identify and understand online transphobia and how that's manifesting when compared to other demographics that maybe hadn't felt that firsthand. It is for that reason, though, that it's important that all young people are able to identify and recognise those behaviours. Coming almost to an end now, but on online bullying, there were different forms reported by the young people that participated. So we had persistent and ongoing bullying, we had prejudice-based bullying, so young people being specifically targeted online because they were gay or because they were trans or because they were bi. We had quite a number of young people mentioning that they had been subject to cruel comments or posts for a kind of shorter burst, a shorter period of time. We did also have reports of young people's images being shared without their consent in order to humiliate them or ridicule them. We had reports of young people being sexually harassed online or at a routine and persistent level. We had reports of swarms of anonymous accounts piling on or targeting specific young people and the impact that had on them. There was lots of variation in terms of what that online bullying looked like, lots of reports of rumours being spread, and so on. Young people knew who was carrying out the bullying in only some cases, and in those cases, they recognised themselves that it was easier for them to report. It's classic if I know who's sending me harassing text messages and I know that person is a fellow school pupil of mine, then there's suddenly, avenues open to me in terms of what I can do about that. If I'm receiving, persistent hate on Instagram or Twitter or Snapchat and it's from an anonymous or a fake profile, I don't know who that person is. I'm relying on social media companies to address that. With young people in that circumstance reported feeling a lot more isolated, and, all of the young people who gave us more details about the bullying they experienced did say that it had a direct impact on their mental health. It felt inescapable, but in those cases where it was anonymous or unidentifiable, it definitely did have quite a pernicious and nasty effect. The most discussed social media apps were Instagram, TikTok, Facebook and Twitter, but a lot of young people did report experiencing bullying behaviours on video game platforms like Xbox or PlayStation. Just to conclude here, because I think this is relevant to all of us as LGBT adults. Everything that we see and experience online, if we are sharing those social media spaces with young people, our age range was 12 to 24, specific, you know, of relevance to the STUC, 16 to 24, those are young LGBT workers. And if we're seeing things online, they are seeing these things online too. And it's taken me to 25 to build resilience to what I see and experience online. A lot of those young people don't yet have that resilience. So I do just want to kind of run through this quickly, but what does online prejudice actually look like? Because it's everywhere. It's hard to open Twitter, for example, nowadays without seeing online prejudice or online hate, but it can manifest in a variety of different ways, from individually sharing hurtful, stereotypical or stigmatic attitudes or posts or memes about minority communities, but also to the organised spreading of hatred and disinformation. This is done on purpose. It's done to incite tensions. It's often you know, manipulated by fake profiles or fake accounts to inflame tensions against certain minority communities. And the difficult thing with online prejudice and hate is that it can reach a large audience very quickly. Young people are telling us that they're experiencing it, that they experienced it at a much higher rate during the lockdown period. And it does have a negative impact on the minority communities who are in the spotlight of that misinformation or that targeted online hatred. Young people are exposed to prejudice and hate online across quite a lot of different mediums. So you do have your classic social network sites, Facebook, Instagram, Twitter, that we all use. And often they're exposed to this type of online content by accident, and it does have a damaging impact on their well-being. But there are also websites and forums like 4chan and Reddit, which are not strongly moderated and are often used to ignite some of the spreading of hatred or the bullying behaviours that we might see elsewhere, as well as on gaming platforms. Media Smarts is a Canadian organisation which monitors online hate, and they have said that hate groups simultaneously put out extreme content that is designed to energise those who have already been radicalised online, but they also share content which is designed to seem reasonable to more general audiences. They share legitimate concerns. So this can include content which is racist, homophobic, misogynistic, transphobic, anti-Semitic, and it's often pushed and promoted through a conspiratorial lens, where minority communities are portrayed as being a danger to majority society, a threat to others, and there's often the use of dog whistles, which are only really can be heard by those who understand. In some cases, this behaviour can be a hate crime, but there is a high evidential threshold of prosecution. But what we have identified, the reason I'm pointing this out, I will get to the point, what we've identified is that young people are seeing this and experiencing this. It is having an impact on their emotional well-being. They're experiencing that in tandem with online bullying. I would task every single participant on this call just now to think about when was the last time that you opened social media? When was the last time you opened Twitter or Facebook and didn't see hostility towards the trans community, or hostility towards the wider LGBT community, or hostility towards BME communities, or hostility towards asylum seekers and refugees? We are surrounded by it. It's a massive problem, and it is impacting on our young people. So I will wrap up there and let others speak. But hopefully that was helpful for you. This report is available online, so I'll stick it in the chat box for you, but thank you.
Thanks, Jordan, for that. I don't know what has happened. I don't think, can people see me?
No.
We can hear you though, Willie.
Okay, that's probably best. Apologies for being a bit late. I had a technical issue in that, first of all, I was trying to get onto Microsoft Teams and then realised that the meeting was on Zoom, and then I had an issue getting into Zoom. So thanks to Erin and Dave for sorting out the issue. My name is Willie Doherty. I'm currently the chair of the STUC LGBT+ committee. Just like to say thanks to Jordan for his, as always, great presentation. Our next speaker is Miridul Wadhwa. Miridul is the rape crisis manager from Forth Valley Rape Crisis, and she's a trans migrant woman activist who also joined us at the last physical event we had back towards the end of February when we did LGBT History Month in Empire House, and we had a great presentation there. So I'd just like to introduce Riddle.
Hi everybody. Thank you for having me on here, and I was very intently listening and trying to read the slides, Jordan, but thank you for saying some of those things and highlighting you know, what COVID has really been like for young people, but also I am currently haven't been at work since March because I'm on adoption leave. So when I speak, I am not speaking necessarily from a work perspective, but reflecting on how it has been interacting with the trans community and the wider LGBT community, and also the BME LGBT community, a community that I had not really been able to engage with in a sort of physical space before COVID. And there are 2 or 3 things that that became apparent to me. So the Scottish government did release money, you know, not the Scottish government, I'm sorry, but the national lottery, the big lottery, and now there's another fund out there to help LGBT community groups to build up their infrastructure, to support their service users and the wider LGBT community in their areas. But what that says is that when they say build up infrastructure, when I say build up infrastructure, so that is money towards all kinds of things, from helping run mutual aid groups, one of which I was a part of, and I was able to support a few trans people through that, you know, helping them with their mental health, or and them helping me as well, actually, and other things. But what I realized was that all of this infrastructure only came because of COVID. While that is a positive, what it highlighted is that this is such an under-resourced space, and that it took COVID to make it possible for these community groups and organizations to be able to do what they do effectively. And so I think, well, what happens when our concerns with the pandemic pass? What is the relationship then of funders, of organizations, the Scottish government, and what is their responsibility to maintaining this infrastructure? And obviously not everybody benefited from that necessarily, but I think that was a positive, but also it highlighted some massive flaws in the community, the resources for community organizations, when we share the burden of change in our society. So we are the ones as third sector organizations going out there and transforming people's lives, providing direct services, but yet we are not often supported in the way that we should be. So, you know, for me, that was really highlighted. The second thing was a much more positive thing. So even while being on leave, I was able to reach out and access communities that I didn't before. And I think that has been really positive for many, particularly, I would say, from my perspective, you know, for the first time I was able to speak to a BME LGBT audience that was spread across the UK and even outside the United Kingdom. So while that was positive, and I think a lot of other people have been able to connect online in whatever spaces, but we also saw the what Jordan said about every time I go on Twitter or Facebook or wherever, there is this awful trans phobia, this hate directed towards trans people. So while so many other things, it felt like stopped during COVID, and everybody's focus was on resolving that. Things did not, the hate that had been being perpetrated towards trans people has not stopped. I felt like to me, it felt like it escalated, and the outcome, you know, of all this years of 2-3 years now of trying to reform the Gender Recognition Act, both in Scotland and in the rest of the UK, is the Scottish bill has now been postponed to the next Parliament. And so we have to endure some more of this when this comes up again, hopefully in the next Parliament. And in England, they've just decided not to do anything with it, by claiming that trans people are not that bothered with the reform of the GRA, and doing very superficial changes. So I think there's the impact of that. So while we've created this community, if we are able to participate in it, we might be able to support ourselves and resolve some of this anxiety and the, you know, the really negative mental health impact of all of this hate as trans people that we've been experiencing. But also, if you're not part of that, so in one of the panels that I did, which was for Hidayah, which was a BME LGBT group, there were supposed to be 2 other BME trans women speaking alongside me, but because of being locked in unsafe homes where they were not out, they couldn't participate. So it again, it brings into focus this lockdown, this lack of not being able to go into spaces that were our safe havens to get out of our homes into our communities, further isolates those who live in danger as LGBT people, whether they are BME or not. So, you know, that's something that I wanted to talk about and just say how that has been. And I suppose being out of work or away from work, I find that, you know, some of the more practical things that organizations are doing, I feel a little bit out of the loop with that, but I know that certainly in the Rape Crisis Center that I work in, my colleagues who are at work were able to transform the way they deliver services to survivors of sexual violence. But again, there are people excluded in this new way of providing support online, mostly people who are not safe in their homes, not being able to access. I'm just going to pause there because I feel like I'm drifting. So thank you.
Thank you very much, Mriddle. We'll move on to the next speaker and we'll come back at the end and ask if people have questions. So our next speaker is Kieran ONeill. Kieran is a member of the GMB and is a trade union LGBT+ activist. Welcome, Kieran.
Thanks very much, Willie, and thanks to you, Ern, and the STUC LGBT committee for bringing tonight's event together. It was really good to hear from Jordan for the Thai campaign in Riddle from Forth Valley Rape Crisis about, you know, their work. I think that report, I've not had a chance to read Thai's report yet, but I think it is essential reading and shows where we need to, you know, take action. So like Willie says, my name's Kieran ONeill. I'm a GMB Scotland branch secretary in the public sector, and I'm also the secretary of LGBT+ Labour Scotland, which is the LGBT wing, LGBT affiliate of the Scottish Labour Party. Lockdown's been really, really tough on all of us. I don't think anyone would pretend that this was easy. And, you know, but I think it has been particularly hard on low paid workers and workers who are exploited, and particularly hard, actually uniquely harsh on LGBT+ people. So the isolation's meant that, you know, we've had to find new ways of staying connected, of being together. For example, you know, we couldn't have Pride season this month, which, you know, is sad, but, you know, those events did take place online. They'll take place again in person at some point. But what that's mean is, in order to stay in touch, in order to stay connected with our friends, our families, our colleagues, our loved ones, we've had to rely a lot more on technology. We have to rely on formats like this, like Zoom. We've had to rely on social media. And at the same time, there is this growing need to use these new technologies. There's been a horrendous surge in anti-LGBT rhetoric, particularly transphobia, hatred against our trans siblings, which is incredibly depressing. And I think many people would recognise the arguments that we're hearing against trans people are the same old tired arguments we've heard against other parts of the LGBT plus community. And while all this is going on in the middle of a pandemic, we've seen two different responses from the Scottish and UK government, but it has resulted in the same thing. So in Scotland, the government won't be going ahead with the Gender Recognition Act Reform Bill, which has been on the cards since day one of this session, and it means that all the parties that were elected with a manifesto commitment to bring the GRA international best practice won't deliver on that promise. And it's incredibly regrettable for me, and sometimes with everything going on, I still don't think it's the right decision. Whereas at a UK level, there is still the hope that it will be delivered in the next session of Parliament, and hopefully very quickly into that session. But at a UK level, we've seen the UK government just go, nah, we're not going to bother with this anymore, in contravention of what they were elected to do. And my union, the GMB, has been very clear and written to the UK minister saying this isn't acceptable. And I know that in Scotland we're seeking to do the same thing with the Scottish government. So Jordan mentioned a lot of statistics there that I do think we have to listen to. But like Willie says, I'm involved in a number of different union and LGBT groups, and there's one statistic I hear quite a lot, and it really, really sticks in my throat, and it worries me a lot in the current situation in which we find ourselves, that despite all the positive changes that's been won, that the LGBT community's won in terms of equal rights, this year we celebrate 20 years of Section 2A, Section 28 being struck off the statute book in Scotland. If you're a young person growing up in Scotland right now and you've had to declare yourself homeless, the number one reason, the reason bigger than any other reason it's led to you having to take that decision, is because you've had a negative experience of coming out as LGBT plus, and that breaks my heart. And we've spoke about the evidence, we've seen it, that over the lockdown, with people being stuck in together. I think the point that Riddle made there about try to have an event with colleagues, but they're not out, so they can't dial into an LGBT meeting from their house. We've seen people trapped in homophobic houses, unsafe environments due to the lockdown, and I think a lot of the people making the decisions at the beginning of this crisis didn't quite get that not your home isn't always your safe haven. In fact, a lot of the times your workplace is your haven from home, and that really puts everything into perspective. So I think coming out of this event tonight, I think we've heard that there's a lot of work to do, and we have to stick together and stand up against prejudice and discrimination. And I think the message that the STUC is saying, that in recovering from the damage that COVID-19's done to our society, that there can't be any return to normal. The old way of doing things was broken, and if we are going to recover from the misery that all this has caused, it's only going to happen by fundamentally changing the way we do business, and ensuring that workers aren't left behind, and that we're able to build a fairer, a more just and a more inclusive country, world of work, whatever you want to call it. So things are grim right now, there's no two ways about it. But I think, discussions like this, the work of the STUC and the other affiliate unions and amazing groups like the TIE campaign and the Forth Valley Rape Crisis are crucial to making the difference that we're going to need going forward. And yeah, things aren't great right now, but I do hope they will get better. And conversations like this give me hope that will be the case. But that's pretty much all I've got to say. I don't want to take up too much time, but thanks very much for having me along.
Thank you very much, Kieran. Thank you to all three of our guest speakers. That is all the speakers have spoken now. Happy to open up to questions, and we actually have one question which has been put to us by Jenny Douglas. And the question is, I've abbreviated it because I couldn't quickly write down enough everything she'd written in the chat. But Jenny's asking, what do the panelists think we can do to ensure that we keep the focus on the GRA reform during the COVID recovery process? Would anybody like to come in on that?
I'm happy to answer it for us. I think that's a really good question for Jenny. And I do think the key thing to remember is, frankly, I don't think the bill should have been put aside, and I think, you know, we won the argument. The vast majority of people that responded to the public consultation wanted the bill to go through. So I think, you know, we haven't lost the argument, despite what it feels like. I know Twitter in particular is a hellscape at the minute, with a lot of really anti, you know, trans stuff. But I do think the vast majority of people want this to happen, and it's the job of, you know, trade unions and, you know, people involved in different political parties to make sure going into next year's election that all the parties, the mainstream parties, have a cast iron guarantee that the GRA is being reformed into international best practice, you know, preferably within the first year of the Parliament. But, you know, that's an argument that needs to be won. But I do think, you know, I think we can't, you know, be defeated. You know, we have won the argument. We just now need to hold people's feet to the fire and make sure the change gets brought about.
Thanks very much, Kieran, for that. Anybody else like to offer any thoughts?
I agree. I think that I think it was wrong to postpone the bill, putting it into the next Parliament. It needs to be dealt with in the first year. It has to be very clearly in everyone's manifestos again that the bill will become an act. And of course, there are some challenges within the bill, which, you know, I don't want them to be there. And hopefully we would be able to influence politicians to amend the bill so that it takes off some elements, including the 3-month waiting period. Because I think that's just nonsensical. It has been put there to pacify those who really are not in the majority, but appear to have the loudest voice. And as far as what we can do right now, I think one of the other issues, particularly for trans people who are transitioning, who are seeking to transition, the extremely long waits at gender identity clinics, the difficulties we have in accessing appropriate healthcare. And I know that there is a report being launched soon, this week maybe, with Waverley Care and other partners on trans healthcare, and that should be something that should guide us in what it is that the trans community needs around healthcare, and, you know, some more focus on that too, because while GRA reform is very important in terms of our position in society, but there are also some real practical challenges. Like it is unbelievable that you have to wait 2 years almost to have your first appointment at an NHS gender identity clinic, and people who are already a community that already struggles with poverty and underemployment and so on is then having to go private to be able to access hormones so that we can survive and live our lives as safely as we can.
Thank you very much for that. We have another question from, sorry, Jordan, did you want to come in on that without just cutting you off?
Yeah, no, I think I'd agree. I would agree entirely with what Riddle has said. I think one of the kind of, you know, one of the negative consequences of this is that, you know, I think quite a lot of people are incorrectly perceiving GRA reform as being the be-all and end-all of progressing trans rights and advancing trans equality, and of course it's not. You know, we know time and time again what trans communities, and particularly trans young people, tell us, well, trans young people certainly tell us that their experiences at school is a major priority for them, their experiences of bullying are a major priority for them, supportive family networks are a priority for them, homelessness is a priority for them, and, you know, healthcare time and time again comes up with adult communities. So it is, to me, you know, I think we just sit with our head in our hands and think, you know, how did we get to a point where, you know, like this whole entire cultural situation has emerged online, where, you know, like as an LGBT person or an LGBT organisation, especially like if you're trans inclusive, you just cannot navigate anymore without being subject to backlash or, you know, horrific abuse, which, you know, Riddle has been subject to, and people involved in our organisation have been subject to, and we got here over birth certificates and the misinformation that was allowed to spread, and I think, you know, from my perspective, governments allowed that to happen. Frankly, there was a lot of misinformation spread, and I just worry now we're at a point where, you know, whether GRA reform is shelved, whether it's watered down, as has been the case in UKG, or whether it comes back on the legislative agenda next year, it's not about GRA reform for the people that are organising against it, because their problem isn't with GRA reform, their problem is with the Equality Act, and we are already seeing people opening up that line of conversation of, we need to rethink the Equality Act, we need to just abolish the GRA 2004, and frankly, as, you know, a gay man, I would be horrified and terrified if the Equality Act was put to that type of public scrutiny. But I think that is the frankness of the situation. The concern isn't about GRA reform. What we all read on Twitter about, you know, single-sex spaces and so on, that's Equality Act. So, you know, they're not even talking about the law that has been subject to all of this. So I think unless it's nipped in the bud, and unless there's a huge effort, you know, particularly by organisations who, you know, work in this field and receive funding to be in this field, unless there is a huge coordinated effort to address this misinformation that front and centres trans people, then I just don't see how we overcome it, to be blunt. It will just continue and continue and continue, because that is the way that hate works.
Thanks, Jordan. That sort of brings us on to a question that was been put to us by Chris Hendry. And basically it's, how do we tackle the anti-trans alliances that are going around at the moment? Do we have any suggestions from anybody in what we can practically do?
Well, can I venture
within the law, obviously?
Can I venture some ideas? I think first of all, this is candidate selection time, and we really need to question all candidates across all parties on where they stand on all equality issues by really probing it, by really probing that you know, in their vetting process, where do you stand on equality, and what is the evidence that you stand on this? And I feel, having recently gone through a vetting process, I don't believe that necessarily happens. But as someone who experiences multiple discrimination, who's worked in equality for a long time, having a number of protected characteristics, that doesn't happen in any sphere. So if you're fostering or going through an adoption process, there isn't a curiosity about where you stand on equality. What is your experience of it? How will you treat difference within the children that are placed with you? So we as a society are not very curious about this. And part of the problem is because there aren't enough people with protected characteristics with influence. So while there might be some of us in positions of power, but I said this yesterday in another podcast, that we would just probably fill a classroom or 2 classrooms, and that's it. So part of the problem these alliances have thrived is because we are not questioning, not challenging enough as a majority. It has been largely left to minority groups to deal with this. And I think that's one way that we challenge this across our society. And of course, I see that something has come about politicians being held accountable. I think they need to be held accountable. A politician asked a question in Parliament, which was sort of anonymous, but it was deeply, deeply awful, around rape crisis centres and how many staff members they have or volunteers they have who are trans, and they wanted to know that or question that. Something, you know, I care not to remember the detail of the question, but I know the politician. You all probably know the politician as well. But it was a direct, pointed question at me. They are not interested in being nice, although they say that they're not transphobic, that they want to wipe us out of any power at all. And we are such a small community that we cannot challenge on our own, but together as LGBT people, but also with an intersectional approach, we should be able to challenge. But politicians need to be held accountable, and political parties need to show what they're doing to take action against their members who are transphobic or any other phobic, for that matter.
Thank you. Anyone else have any comments on this question?
In violent agreement with Riddle and everything that was said, you know, I think the main, like Chris's question, how do you deal with it? Zero tolerance, and, you know, like transphobia is not just something we leave to trans comrades to deal with. It's an issue that all of us need to challenge, just like we don't expect we don't leave people when they're facing discrimination and bigotry. We all together should challenge it. I think the STUC has been really good at that. You know, I can think of a couple of examples when some other groups haven't, you know, done that, and the STUC always has. So I really need to commend that. I think that a lot of that's down to the STUC LGBT committee and the work that they do. But you know, it's utterly grim at the minute. And then Riddle's point about political parties clearing out, you know, sorting out their own house is really, really important. And at the end of the day, I find it really, really depressing that anyone would want to get involved in public life or try to represent people, but know people that were different for them. I think it's really dangerous, actually. It's incredibly disheartening. So I think, you know, at the end of the day, these groups and these alliances don't speak for anyone other than a really, really small minority that are just quite hateful. And I think, you know, it has to be challenged and they have to be stopped.
Thanks, Kieran.
Just to come in kind of briefly on the back, I would agree with Kieran and Riddle in the sense that they speak for a very select, you know, amount of people, a very specific target market, demographic and generation, that, you know, I think, you know, any under the work that we do, we research LGBT history, we translate it into school resources. So any understanding of LGBT history, and you will see this same stuff, you know, back 60s, 70s, 80s, the same types of arguments were there when it comes to, you know, some of the hostility towards trans people. And I think, just to be like, I think I'm a wee bit, we've not had a very good day today. We've just not had like a good situation, which and I'm just kind of done with like being like holding my tongue and not saying what I actually think. So it's like, as far as I'm concerned, you know, like it's a disgrace, like that so many people are forced to endure that online. But I also do think that we do need to you know, to some extent recognise that it does exist by and large in online spaces. And what is happening, you know, like we're living in this just completely bizarre period just now, where we've got like the rise of QAnon, the anti-intellectual culture, the we're fed up of experts crowd, and unfortunately the trans community, and very reasonable ask from the trans community about a piece of bureaucratic legislative process that only affects the trans community, has been caught up in this just completely bizarre culture world that we're living in. So I think people are being radicalized online, and, you know, I'm sure the people that have been radicalized online won't like the fact that that's the way that some people view it. But it's, you know, if you want to know how to address it, then like how do we deal with online people that have been radicalized on the internet? How do we deal with the widespread kind of push of conspiracy theories? You know, it completely doesn't surprise me that a demographic and population of people who have believed since 2014 that there's MI5 British Unionist spies infiltrating the Scottish government now also believe that men will dress up as women to enter toilets, rather than just potentially, you know, pick up a mop or walk in, as they have historically done time and time again. So I think like we do need to really understand that a lot of this rhetoric and argument is rooted in the language of conspiracy theory, because that's how prejudice is spread. You know, and like they don't like it when you call it a conspiracy theory. They don't like it when you say that they've been radicalized. They don't like it when you say that it is pushing a hateful agenda, but it is. You know, like over 5 years we've been working in this sector. Who knows how long we'll be working in this sector kind of from here on out, but 5 years we've been in this sector, and over the last year. You know, like we've been called groomers, child abusers, paedophiles. Liam's had his daughter's photo posted across the internet. We've been accused of sexualising children. I've had pictures of my 2-year-old sister posted across Twitter. I've been called a groomer for having her in my profile picture. Why? Because we've been vocal in support of trans people. And what happens is it comes at you and it's homophobia. You know, like it's transphobia, it's homophobia, and it's the same people, by and large, a lot of it is the same people, you know, that wouldn't have turned up to a Pride match over the last 20 years, but have only decided to get involved now because they've been upset and bothered by what some 13-year-old has written on Tumblr, you know, or like it's people who would once upon a time have stood in Buchanan Street and shouted that we were, you know, we were sinners or we were abominations or, you know, any old other slur, who have now just got Twitter accounts. And I think the fact that we are just surrounded by this non-stop, like, it just totally does my head in. My advice for how do we overcome it: recognise it's online, have offline conversations, hold all of the people who are putting themselves forward for this election to account, make sure the parties have this in their manifestos, write to every single one of your MSPs, and do not let the internet and Twitter make you feel like this is a much bigger problem than in fact it actually is. Our issue is that I feel like we are moving into a society where politicians are legislating based on what they see on Twitter, and journalists are writing stories based on what is trending on Twitter, and I think that's just bizarre. And I think, you know, if we're going to overcome that, then we need to do the work offline. Don't get dragged into the debates because it's a game to them.
Okay, thanks very much, Jordan. That's interesting, and some horrendous examples of what's going on. I'm conscious of the time, and we did have one more question, but I would like to ask to finish off by asking a question of each of the panelists, and it's the same question. I'm just going to ask you, if you had one message to give to the people watching us this evening, what would it be? Do you want to start, Jordan, since you're on?
One message I think I would probably say is please don't be complacent. You know, like I'm sure there'll be people with us tonight who are experiencing the harsh end of what we've been speaking about and are experiencing that directly in a way, you know, that I'm not even experiencing, who will know not to be complacent. But I'm also sure that there will be some people who, you know, think that, you know, I'm all right, Jack, or you know, that unless their protected rights are there to be taken away, and I think, you know, that what we're seeing just now in terms of some of the wave of where things seem to be going as a coordinated and organised effort to remove trans rights and then work their way back through the rest of us, and I think that's transparent, to be honest, to anyone that's got you know, an iota of a brain cell. So yeah, I think my main message would be try and stay positive, but also stay alert and stay complacent, and have offline conversations because they are so important.
Okay, thank you. Kieran? Sorry, couldn't unmute myself. No, that's fine. Whoever comes in first.
I'm a wee bit younger, but my general thing, you know, I think a lot of people had to give up an awful lot to get us at the stage now where, you know, the LGBT plus community has a lot more rights than it used to do, and you know, that fight's still going on. So I would just say that it can be grim, but don't give up hope, and don't ever think for a minute that, you know, we're the bad guys, despite what some people might want to try and do. And yeah, I think Jordan's point, don't get complacent. You know, these things were fought and won. They could easily be, you know, taken away. So it's important not to, and to organise, you know, don't mourn, organise. It's that simple. But no, thanks very much.
Okay, thank you.
I think what I would have said has already been said. So what I would say is build a community, rely on your community. Equality is fragile, but you know, if you are united, then it's not that fragile.
Okay, thank you very much. I've been informed in my ear that I'm mistaken about the time, and we actually have half an hour left. So we did have one more question, and I'll sort of rephrase the other question, because I'm just conscious of the fact that next week is Mental Health Awareness Day. So the question really is, what can unions and the STUC do now to support LGBT members' wellbeing and mental health? You know, obviously we can put on events like this to have people being able to get their voice heard or to ask questions, but is there anything that we can provide more of? Or
it's not so much an issue in my workplace because we're a bit of a smaller branch, but I heard anecdotally yesterday from a colleague in another union that they're having to do a representation for a member because their actual shop steward didn't feel comfortable doing it because it was quite a complicated issue to do with discrimination. So I think training's still really, really important, come a long way, but I think there's still an institutional thing that's a bit like, well, this isn't a workplace issue. I mean, discrimination is a workplace issue, and you can't just leave it to LGBT plus people to deal with. You know, there needs to be intersectionality, there needs to be support. But I think a lot of the work that the trade union movement does is really, really, you know, my own union, the GMB, have done some phenomenal work in this, and I know the STC has as well. So I think more of that, but you know, we shouldn't pretend that we're all nice and cuddly and friendly and progressive in the trade union movement, because it's just not the case. So I'd say training and education is still really, really crucial. That's probably the number one thing that should be done.
Thanks, Kieran.
I think similarly, a reiteration of what the Equality Act actually is and says and does, and also to members and to, you know, organizations is pretty important, particularly bringing more clarity on what are the exemptions in, you know, where trans women in particular are legitimately exempt. I think that there will be organizations that might use that as an excuse now in this heightened hate-filled frenzy to exclude and use it more. So I think the need is to be really clear and clarify, because what I have seen is statements that, you know, you can exclude as long as you have good reason, but no one is really spoken about what those good reasons are, because as far as I'm concerned, there is no good reason in which you can exclude a trans woman. Like, I don't understand what this good reason is. You know, so it would be helpful to have more detailed clarity for both for LGBT plus people, trans people in particular, but also for organizations, so that they don't fall foul of the Equality Act or empower those who should not be empowered.
Okay, thanks.
So just on, sorry, was the question around how do we do more around mental health in the workplace?
Yeah, is there anything practical we can do around mental health for our members and our wider workforce?
I think like when it comes to mental health, I think sometimes, you know, especially after the explosion and conversation that we've seen over the last few years, I think that to some extent people are still, you know, people and institutions are still potentially taking a reactive approach to mental health of employees and, you know, young people and members, rather than being, you know, proactive. And when I say proactive, I don't mean, you know, a training session about this is what, you know, we all have mental health and this is what X, Y, or Z can look like, and, you know, those are good and those serve a purpose. But I think that to some extent we're missing potentially a little bit of, you know, just more broadly and generally, something more proactive around how do we build resilience as individuals, how do we build resilience as communities or workforces, like how, you know, how do we create an atmosphere and a climate where, you know, we are putting our individual and collective well-being first. So I think my only, as far as I'm concerned, you know, whether you're a public institution or a private business, mental health, the mental health of your workforce, the mental health of your colleagues comes above and beyond anything else, whether that's profit, whether that's targets, whether that's meeting, you know, outcomes from your grants or your funding. You're not going to achieve those goals that you're setting yourself if you've got a workforce with poor mental health or, you know, poor, you know, collective, if you've got a poor working environment. So I just think that it should really just be common practice that every workplace prioritises mental health as a matter of common sense, and is proactive rather than reactive. Far too often, you know, just in the work we do, far too often we see people only reacting once something has gotten bad, or once someone has spoken up, or once someone has, you know, put up a tweet that's went viral or got a few hundred likes. It shouldn't get us to that point, you know. We have to be proactive.
Can I just sorry, can I just come back in? I think I misunderstood the question, so therefore my answer. But I agree with Jordan, and you know, as a rape crisis center worker, the mental health of our team is very important, because if we don't have good mental health, we can't support people. So really investing and spending money on mental health and taking away the shame for seeking support, because I think that is a huge issue in so many workplaces. People are just not willing to acknowledge that they experience poor mental health, and also there is no access to confidential mental health support, you know, on tap, which I think organizations can provide.
Okay, thank you. I think it's quite an important thing, something my own employer has invested quite heavily in, is the mental health first aid training, which I've personally done, and it's really opens your eyes to what situations people are in that you might not know, and it gives you practical ideas as to how, from the very simple fact of the first question you should ask somebody is, are you feeling suicidal at this point in time? And I was quite shocked at that, to think that you would go and ask someone that question. But however, what they say is that the percentage of people who are stopped from doing it by being asked that question is quite big. So it's something that we should look more to do. I know within my own union there were requests to put the mental health first aid training on the training programme, but there were some questions about it because people were unsure, because they thought that people would then see themselves as practitioners, whereas they're not practitioners, they're trade union reps. And I think it was a fair point, but I don't think that's something that should stop us from progressing something that is a really positive impact that can give to people. Does anybody else have anything further to add or to ask at this point?
See, just on your final point there, Willie, around you know, a hesitance in case people are seen as practitioners, I would obviously disagree with that. I think everyone else would, but I think it's less about, you know, in response to that, what I would say is that it's less about, you know, being someone who is, you know, the mental health person, or you're a practitioner. It's there are situations that we often hear about on conferences or webinars, or we read stats about, and until it, you know, hits you in the face, then you aren't going to know what to do about it unless you've been trained. At the start of lockdown, I was driving home and saw a young guy, turned out he was only a few years older than me, standing on the edge of a bridge, and it just, to me, you know, it just didn't feel right, and there was a gut instinct, and I had turned around and went and spent a bit of time with him. But that whole situation, which I won't go into detail on, was really, really difficult, and the only reason, and immediately for me, some of the mental health training that we've done at TAI and the suicide prevention training that we had done just automatically kicked in, and I know that without that training, I think my heart rate would have been up a lot quicker, whereas that I was able to deal with it in a much more kind of productive way. So for me, it's, you know, it's not about making you a practitioner, it's about equipping you with some of the skills that you might need in real life, because, you know, these things happen unexpectedly, and they happen so much more often than we talk about.
Yeah, Jordan, we've had a question come in at the last minute, and it's particularly towards yourself, and and it's asking about how do you think people can build up, individuals can build up resilience against the online abuse that they get.
Delete Twitter. No, I'm joking. I mean, I'm half joking. Do you know, I think I'm the worst for it, because I say to myself, you know, like I'm not going to spend time on Twitter. I'm not going to check social media, and then I check my screen time thing at the end of the day, and I've spent like 8.5 hours scrolling on Twitter and falling into rabbit holes. But like genuinely, I think you know, like some of the there's been a lot, like just through the duration of the TIE campaign, that we've never really spoke about. Liam and I are both what I would call maskers when it comes to mental health and things like that. Like you just put on this mask of like that you just continue on. But there came a point kind of you know, last year where I did have to just be like, right, this is enough, and put some mechanisms in place about how I deal with it, because I am the kind of person, I'm sure like a lot of people that might be on the call, that will just very quickly fall into rabbit holes online, and all of a sudden, like, I feel as though, you know, I feel completely deflated, and I can't understand why people think this way about trans people or the wider LGBT community. And then I think, oh my God, like, what is happening to the world? And then I just end up thoroughly deflated at like 3 in the morning because I've chose to sit on my phone, rather than, you know, maybe finishing the book that I've been trying to finish, or playing my PlayStation, or watching a film. And so for me personally, it's about distraction, and also about knowing that there's absolutely no duty on us to be spending all this time on social media at all. I think you know, use it for your work if you need to. I'm being increasingly grown to believe that the internet was a massive mistake, and you know, it's something that we really, it's probably one of the worst things that's happened to humanity. Potentially also the best, but I'm a bit of a pessimist. But yeah, I think, you know, just know your own personal boundaries, put your phone down, and remember that you're in control. Like, I often talk about social media as being like a restaurant. Like, why would I walk into a restaurant and stay there if people were being racist and homophobic and shouting abusive language? Like, that's Twitter and Instagram and, you know, a lot of these places. Just switch it off and delete the app, same way you would turn around and walk out a restaurant if that's what was going on. Take a break from it. And also block people, block generously. I used to be paranoid about blocking people in case they screenshotted, but now I just block absolutely everyone. I don't care if they screenshot, because it's a very childish thing to do. So block, take breaks, and just remember that there's no duty for you to be on the internet.
Excellent, thanks very much for that. It is interesting because I think we can all recognise what you've described there about you get yourself so involved in something and it completely sort of dominates your mood for the rest of the day. And I mean, most of us have probably got experience of that. So it's something to think about, and probably something, if we're producing like mental health guidance or whatever, that we should be looking to put some things and some practical measures into it, like exactly that. I see we don't have any more questions, so can I at this point in time thank the panelists, Jordan, Riddle and Kieran, for your input and for giving up your time. I can also thank everybody who has joined us tonight. And can I thank Erin McCauley and Dave Moxham from the STUC for their technical expertise and for making the practical arrangements for us to be together. Hopefully we'll do more things like this. We don't know when we'll be able to get back together physically, but in the meantime we realise that we still have a job to do, and we will continue to do it in whatever ways we can. So at that, can I just say thanks very much for joining us, and enjoy the rest of your evening. Cheers.
Thank you.
Thank you.
Thank you.